I'm going to demonstrate a mobilization with movement technique that actually would be somewhat of a progression from just doing the mobilization at the ankle for at the distal TibFib to increase mobilization of dorsiflexion for someone who had an inversion sprain or even possibly a high ankle sprain. So this is a mobilization with movement anterior-posterior non-thrust manipulation applied to this distal TibFib. So I have my patient lying or seated or lying on a table, and this is actually a non-weight-bearing mobilization, and the progression would be to weight-bearing, which I'll demonstrate in the next video. And so I'm going to first make sure that she's in that open pack position so that I can actually get some mobilization of that fibular head. And because there's going to be edema, and well, first, of course, my patient's been cleared that and doesn't have any of the indications of being positive for the auto ankle rolls. And I've also done a figure 8 to have a baseline for her edema. Then I would want to actually increase this dorsiflexion, because the reason that we do mobilization with movement is to increase dorsiflexion, to increase that range of motion that will be limited because of that edema, and then also increase strength, because if you don't have that range of motion, you're not going to get strength and you can lose strength. So first I'm going to have her in this open pack position and get some mobilization and bring that fibular head, because with that inversion sprain, that actually pushes that fibular head forward and dorsally or caudally, so internally and anteriorly. So I want to bring her more posterior. So in this closed pack or open pack position, I'm going to bring her posteriorly and then bring her into dorsiflexion. I'm going to use my hip, but I like having my hand here since her foot is right off the edge of the table. She's stabilized. I'm going to bring her into dorsiflexion and holding her forward, then bring her into plantar flexion. And I would do this for a few minutes or to patient's tolerance, because this is not going to be very pleasant with every patient, but we definitely need to have that fluid moving, and keeping this movement will definitely increase the healing properties of the tissue internally and decrease the chance of any contracture or lack of dorsiflexion once those tissues are healing. So this is that mobilization with movement for the anterior posterior non-thrust manipulation for the distal TibFib.